Well, hello and welcome to all of our viewers around the world. I'm Fiona Langsharp, IBCLC Director of Communications and MC here at Gold Learning. Welcome back. If you're joining us again, you know what we do here. We have such a great opportunity to work with our special guests and presenters from around the world. But of course, welcome if you're coming in for the very first time and listening in. We love to sit down with all of our gold presenters who are upcoming and going to be speaking with us in, the near future. And for this particular event, I'm very excited to have Anna Lagrange with us here today. Welcome back, Anna. It's so good to have you here today.
Hi, Fiona. Thanks for having me.
Yes, we're so excited to have you back, Anna, and you're going to be talking about also, well, I'm going to keep it a little bit of a surprise first because I want to talk about the actual day, and then you'll all know what's happening because we actually have a day of learning and we have three incredible presenters, which of course includes yourself, and we're going to be talking about advancing lactation skills through clinical case studies. So there's the key words there. Anna's going to be talking about some case studies, and so many of you have actually been asking for those case studies. Anna, what do you think? Why do you think that case studies are so important to people these days?
I love case studies. I actually, I teach a fair amount, and it's something that I started to include about 2 years ago. So when my teaching started moving more online, less in person, I realized that it was just a really important part of learning for people to be able to see how other people are practicing. And also just it's that kind of link, isn't it, between theory and practice and how we actually use our knowledge with with our clients, and when we're learning, it's just nice to see examples of how people are using those skills and those tools. So yeah, I personally love a case study myself. I think as well there's that storytelling element as well,
Sure.
that kind of humanization of we don't just always want to talk facts and what ifs. Sometimes it's nice to just have that human story and see how it all weaves in together.
Yeah, absolutely. And of course, I've listened to you before many times, Anna, and you are the greatest storyteller. But as a clinician, I just find that your tools are so practical. There's nothing abstract that comes into play. You know how to pull it all together and really showcase your skill set, but also, learning from your families. I think you're very humble when you teach as well, as your sort of, parents that you've worked with, they've taught you that your greatest lessons. So I always love hearing that from you, and you're such a collaborative worker as well. So appreciate you bringing all your skills here. But Anna, I know you've got some updates for us. You've been doing all sorts of things. And as a reminder, let people know where you are and what you're doing, because I think that people know you from a certain part of the world, and you've changed locations, if I can say that. And I think that's just brilliant because it's giving you an even broader sort of perspective of what's happening around the world. So please, tell folks what you're doing and where you are these days.
So about 15 months ago, my family and I moved over to Cape Town in South Africa from the UK. So I met my husband in the UK in 2000, and he's been meaning to move back home to South Africa for all those years. And he finally persuaded me, sort of kind of another pandemic decision, let's go and give it a go. Before our kids get too old, let's go and spend some time with his family in Cape Town. Let the kids be with their cousins and just explore that other part of their heritage, I suppose, and their other side of their family. So we made the move, which is, as you know, moving countries is, and I'm sure many people watching, is a really big thing. So of course it's always more than you can ever imagine. But it's been great. It's been great. We love it here. The lights going out, that's the South Africa power cuts. So there's a few things that we have to get used to living over here, I have to say. But it's been all worth it. Yeah, it's been absolutely great.
Well, I mean, it's amazing that, you did it. It's such a big challenge for those of you out there. Like Anna said, if you have been a transplant to another country like myself and Anna, it is a lot to take on, and, it takes a lot, but there's so much learning, and you're very gifted. And I know your local community is embracing you, and, you're speaking for them, but you're also doing a lot of work online as well. And I've got some amazing classes that you're teaching. Tell me a little bit about those that you're actively teaching right now.
Yeah, so I teach mindfulness-based lactation support skills. So from all the way to people who want to just get started and come at that sort of, in the UK, we'd call it that sort of peer support level, that kind of supporter level, all the way to sort of lactation consultants and other health professionals who would like to kind of enhance their clinical skills a little bit with something, I want to say softer skills. I don't even really like that term very much, but I think, you know what I mean, like things that support the emotions. And I don't want to give too much away about my talk, but there's going to be a few little hints and ideas that people can use to extend the emotional support that they already give in their lactation work. Yeah,
that's amazing. Yeah, let's talk about your presentation here just for a minute. So Anna's presentation, Being Mindful, Case Studies of Mindfulness Tools in Clinical Lactation Practice. I am absolutely fascinated by this topic. I think that it's so underrated. Mindfulness as a whole, you know, I'm sold on it. So, you know, call me biased, whatever you want right now as we talk about this particular topic. But it is one of those things. Mindfulness came into my life many years ago. Like, I think like many people, it's, you know, catch it on the headlines, you know, we're all trying to do a little bit better in our lives. And then it sort of dissipated. And it was actually my partner that brought it back to my attention. And he was one of those people that said he'd never do it. But we're seeing a lot of people who said they'd never do it. And it's garnishing more attention. I feel, Anna, it's because it's not sort of it has a lot of I guess there's no parameters to it in a lot of respects. It's done in many different ways. It can be done, you know, I think initially people thought it was quite like it was a long period that you'd have to spend in mindfulness to get the benefits. And we're such a fast, you know, society today. We don't have a lot of time. I don't have the time to do it. You know, you hear a lot of those things, but really mindfulness can take minutes, really, right?
Yeah. No, literally minutes. I mean, we can bring our body into a state of relaxation in 3 minutes, is what the research tells us.
Wow.
And just that alone, to have a consistent practice of that for 10 days consecutively will completely change our body on a physiological level, and it also help us, you know, with our thinking and our mind. And so it really doesn't need to be complicated. In fact, it's sometimes I do feel like a little bit of a fraud talking about this stuff because it's so simple. It's like, it's not, you know, it's not really complicated. We can all do it, but often it's that kind of reminder. And then it's also, I love teaching about the kind of science behind it, the neuroscience, and also the endocrine, you know, hormone system as well, because that's so key to lactation and the work that we do.
Yeah, that is brilliant. Well, you heard it here first. If you haven't, you know, looked at it before, but let me tell you that our families are looking for tools, and this is definitely something that you can pass along that doesn't take a lot of time, that is it's free. I mean, this is something you don't even need equipment for in that sort of sense, you know. And so this is just really such a brilliant, you know, thing to add to your toolkit, and we'll be expanding. And I know you'll be teaching us, Anna, you know, how to expand our, you know, skill set and tools to pass along to our families. So thank you so much once again, you know, for joining us here at Gold and talking about this amazing topic and expanding our sort of, you know, just our insight into all of these things. So Being Mindful, Case Studies of Mindfulness Tools in Clinical Lactation Practice. Anna Grange, thank you for joining me here today.
Thank you for having me again, Fiona. I'm really looking forward to the live day. I can't wait.
Absolutely. And for all of you listening, and don't forget to head over to our website right now at goldlearning.com, and you will see our bundle that we have for our Gold Learning Day, Advancing Lactation Skills Through Clinical Case Studies. We'll look forward to seeing all of you online. Thank you for joining us here today, and have a wonderful rest of your day. Bye-bye for now.